Thank you very much for giving me this opportunity to present some of my thoughts on the day of technology, mental health in the world of digital technology. In fact, you would remember that this is one technology which has changed our life. Good old days, we used to see black and white film, and today you see Technicolor films. The change is of that magnitude. Every individual is touched by this change. Whether he is a child or an elderly person or a woman or any high-risk person, whether in village or in cities, in this country or 10,000 kilometers away from any other country. If there is one thing which has changed the world of people as far as healthcare is concerned, that is digital phenomenon. It is not that it is for the first time India is seeing technological advancement. We have seen plenty. We saw machines, ECG machines, EEG machines, scans, brain scans. But all those technologies were for patients. They were helpful in early diagnosis and treatment of people who suffered from number of difficult medical situations. They did not play any role in a common man's life. They did not play any role in prevention or promotion of mental health. But digital phenomena is one such phenomena which is changing everybody. It is changing the way you learn. It is changing the way you want to educate. It is changing the way we want to diagnose mental conditions. And it is also changing the way we want to prevent mental disorders. We will see in this presentation how we have succeeded. And thanks to all those scientists, bureaucrats, governments, funders, economists, those who tried hard to put together this advancement, whether in form of internet or in form of software development or hardware development, developing mobile apps, or number of startups. India today hosts more than 88 indigenous startups in mental health alone. All over the world, it's a business more than $3 trillion. That's the significance. It is not because it is changing the face of patients suffering from mental illness, but it is because it is offering opportunities to people to promote their mental health, to prevent a mental disorder, to bring psychological component into daily lives. That's the significance of this technology. Power of internet, the presence of internet has divided the world into two. Those who were born before internet and those who are born after internet. Those who have access to internet and those who do not have access to internet. And these four categories are very vivid, very obvious in a multidimensional society that we have and we are living. Rural India, urban India, semi-urban India, and people who are privileged, people who are underprivileged. We saw in times of Corona, when education was made online, all students had to study their courses based on internet and mobile technology. But we saw that more than 70% of children, adolescents in rural India did not have access to connectivity. And that created another panic. It created a mental health condition. It created a situation where they were exposed to a number of risks. The fear, the trauma, discrimination, suspiciousness of being lagging behind, questioning why do I not have the facility. But there was no option. It was a natural calamity. There was no way one could have coped better than what Indian people did. And in that crisis, it is to be remembered what helped mental health best was the digital technology. It is in fact at this time India experimented one of the finest exponential experiment in mental health, which is popular as Telemanus. Telemanus, a project of Prime Minister's Office Scientific Advisor and National Institute of Mental Health and Neurosciences, Bangalore, and Hyderabad IT Institute, all three put together, they evolved a very unique mental health facility available in about 23 countries under leadership of National Institute of Mental Health and Neurosciences. It is a government-funded project managed by the government employees and a lot of volunteers. 14416 is the number. You dial, you speak to a counselor, a psychologist. They take you through to district mental health program. They provide you education. They deal with your crisis. They provide you support and refer you for a psychiatric evaluation if that is required. That has changed the mental health canvas. It has not only changed the canvas, it has set the benchmark totally different. Now everybody who will think about developing mental health services will begin from the floor of Telemanus. It is that important landmark I would consider in the history of mental health service development in India. And I congratulate the governments and people, the psychiatrists and the scientists, to take such proactive steps to provide this specialty nationwide, highly professionally based. I have seen number of services. You see England, European Union, other countries, you see United States, number of countries. Most of these services have very little involvement of qualified psychiatrists. They all are run. It does not mean that it is run poorly. No, that's not the problem. The issue is that a good amalgamation of professional excellence and social excellence, volunteerism, people, all on one platform is the uniqueness of this project. So Telemanus is to be remembered as a landmark decision of this government, which has brought mental health services at your fingertip. Try to remember, maybe 1960s, 70s. If you are living in a village and you have somebody developing a problem in your family, in your grandfather, your grandmother, what options were there? You come out of the house, send some of your friends to local doctor and wait that some Masiha would come and save the situation. Such pathetic situations persisted. It is important to watch this clip. The legendary actor performing a role for seeking help seeking. Today, that situation has changed. Everybody has a mobile phone, a smartphone or a cell phone. You have certain numbers, you punch and you get those services. Maybe there is problem of credibility, availability, accessibility. Maybe there is problem of traffic, ambulance do not move. But still, it has made a difference. And let me also put on record, our country is not the only country facing the crisis of accessibility of care. Entire world is facing due to a number of problems. For example, let's say United States, 33% people have no access to mental health care. Let's say Canada, 30% of Canadians do not have a direct access to mental health care for routine and as well as for emergency. They are good in handling psychiatric emergencies. It's readily available, but the routine care is extremely difficult to get. So there is no option but to bring innovations, new thought, new programs, new technology to change life of people. What exactly it has done? The connectivity has empowered you. It has given things at your fingertip. Now you control whether you want to seek help, whether you want someone to approach you or not. There is a catch here. The catch is that now the responsibility of being educated rests on you. Because if you are not informed, it is not like you are not likely to press the button and you are not likely to ask for the help. I'm also afraid whenever the power of seeking shifts to the hands of people who are innocent and maybe ignorant, the states gradually withdraw and the gap which widens becomes a problem in future to manage. So let's see what are the significant areas where it has made a difference. The first difference it has made is reducing the gap between availability and accessibility. As you all know, that our treatment gap in mental health is extremely large. Considering that 16% of India's population has one or the other serious mental disorder and availability of care is just for 15%, our treatment gap is somewhere around 82-85%, whether it is for children or it is for adults. And our services for rehabilitation, relocation and employment support is also very different, much poorer than it should be. But now, at least, because of new technology, newer ways to look at the problem, the gap is likely to reduce. More and more people are likely to be more informed. They are likely to talk more. They are likely to seek more help. They are likely to ask their doctors what to do, what not to do. And maybe there will be many more mental health professionals to help them because there will be more interest in students to opt for this subject. There will be more courses, more education, different kind of avenues available so that delivery of care becomes much easy. The second important aspect which the digital technology is going to do, it's already done, is significant reduction in stigma. People by and large have desire to seek information. Nobody wants to live in consequence of misinformation. But so far, the source of information was not available. If I was lecturing in a college or any school and the principal asked, where do I get the information from? Then I would be saying that I will send somebody or somebody will talk to you. We did not have availability of information readily to people and we continue to blame them that they are ill-informed or not informed. But now, with information at the fingertip, people are more inclined, more interested, more inquisitive to seek information. More and more they will seek information, more and more they will be inquisitive to examine themselves and have others examine them for presence of stress, mental disorders, severe difficulties, the challenges of life, and their problems will be much more easily and readily dealt with. The third important aspect which is the outcome of digital mental health is that of prevention and promotion of mental disorder and promotion of mental health. The whole talk of combining health and moving health model to wellness model, making people realize that healthy body matters, healthy mind matters, this thought is gradually gaining momentum. The good part is that more questions are there, more answers are available through education, and it is empowering people to reform them. There we have extremely beautiful mobile applications, startups and other softwares which provide information. Say for example, you go on an app and punch that I'm not getting sleep. You see the sleep app, examine the cause, and you will get some support from some education or chatbot how to regulate your sleep. You have number of problems of mood swings. You go on different kind of programs. They will tell you how to monitor your mood, how to regulate your mood, what to do to maintain your mood. So these kind of things are going to play a pivotal role in bringing technology in forefront in life of people. We have to thank for contributory phenomena of various laptops, mobile phone, the instruments, the cloud, mobile connectivity efforts, and the governments, bureaucrats, scientists, they all need to be congratulated. We are not going to be deterred by the numbers that 880 million people do not have connectivity, or more than 120 million people have mental disorder. Fine, that's the way the situation is. But the technology is offering a window of opportunity and a lot of trust and hope. And I'm sure in times to come, things will be taken care of. Before we move forward, it is worthwhile having a look at the historical development of digital technology and blending in mental health issues. In fact, it somewhere started in 1950s in the rest of the world, but in our country, it has really taken a speed in somewhere in 1990 or year 2000. A major change came when the spectrum became available and mobile technology connectivity increased. On the other side, a lot of development in different software development started in 2010 and 2010 to 2020, and now in last 4 years. If we go and see that it's around 1,800 publications in last 4 years covering the topic of digital mental health on various aspects. Its development in technology, its software development, various ideas in Indian startups, and then its testing its effectiveness in various clinical situations. Then there are publications which have amalgamated the results and conducted meta-analysis to really come to a conclusion whether the modern digital technology is effective or not effective in treatment of a patient, whether the purpose is identification or assessment or providing a particular type of intervention or using it in various models in rehabilitation, whether it is doing what it is supposed to do or what it claims. It has been scientifically tested, and number of publications have again applied to meta-analysis technology to see what is the level of significance of effectiveness which comes to. I must mention here a sense of caution which scientific community has, and they find that though mobile app technology and digital technology is an effective tool for assessment, identification, intervention, therapy, prevention, as well as in protection, but with a caveat that all of them are not good enough. They do not design which conforms to their own objective, or they use methodology and questionnaires which are either quasi-scientific or falls much below the standard scientific benchmark. Nonetheless, we must understand that it's an evolving process. We have not yet matured in development of digital technology to help ourselves. There are a number of barriers. The first barrier is the identifying the need of the community, need of various sections of the community, need of several high-risk groups. Let's be very clear that there is not going to be one universal answer. The mental disorders, psychological risk, and psychiatric interventions are so unique and custom-made and tailored that it is going to be impossible to find out which technology is suitable in which condition. For example, when we say that somebody has developed a tool to identify eating behavior or eating disorder in school children. We must also remember that eating disorder does not exist in isolation. About half of the children, they do have number of comorbidities like anxiety, depression, and ADHD. Now, when the tool is designed with less perfection or with not much of thought of scientific process or with lesser input from clinical team, the consequence is that it remains just too pure, and there is no condition which is too pure in the community. Then our false positive and false negative percentages are very high. When they put it in front of the community in practical usage, there are no barriers, there are no guidelines, there are no regulations that whether it is supposed to be doing what it claims to be doing or not. The standard operating procedures, the clinical guidelines, the clinical guideline reviews, various terms and conditions have not yet been laid down very specifically. American Psychiatric Society has laid down the task, developed a task force which has made recommendation, but as of now there is no bar that you cannot put a mobile app or a technology into market, whether it does its job or it doesn't do any job. This I have had first-hand experience in reviewing some of the software, and it is pretty evident that the kind of questionnaire which has been used are not very adequate, very specific, or very selective. So while on one hand there is several advantages, there are number of difficulties, number of challenges. We know that our healthcare by itself is full of challenges. There are challenges of resource, there are challenges of money, there are challenges of professionals. The doctors are concentrated in city and urban areas. The rural regions are deprived. They are dependent upon multi-purpose workers who are less qualified and less skilled and less educated than the docs themselves. But these are the practical problems. Then there is issue of stigma, awareness, unawareness, ignorance, denial, access of care, not able to recognize the symptom, lack of education, and so on and so forth. But now that digital technology is available, it is hoped that power of education and the power for mental health education will also rest in the hand of consumer, and they will be able to take advantage of the situation. They will be able to inform themselves in order to help promote not only their physical health but their mental health as well. So when we say that significance of digital mental health, it's an evolving process. So far, not much has been achieved concretely, except there are good documentation devices, good data management device. You can store data much better, you can record data much better, you can share this data much better, you can have consent, capacity, informed consent, permissions, declarations, all very easy. You can transfer the data very easily. So somebody is treated in California and now the same person is in Nagpur or in Mumbai. It will be possible to transfer the data for healthcare once the governments develop this kind of logistical arrangement. But so far, though there is technology, but in our country, the information sharing and data management doesn't exist even within two doctors, unfortunately, because it's a very expensive job. I mean, it's going to bring challenges into clinical practice. And the challenges are, where is the time? Who is the person? Who is going to do? So you are going to need a data management administrator, a data management researcher, a data management, and a data analyst. If you, so for example, there are doctors who see 100,000 patients in 2 years. That's a very big number. And if you want to record a data, document everybody's illness, prepare a common minimum background, then it's a task. It is it is going to add a new dimension to clinical practice, and it's going to add more and more cost. But I'm sure that there will be answers to these challenges. It has just started. Good thing is that we are seeing a ray of hope, a possibility that yes, we can manage our problem in this manner or that manner. Stigma and awareness is a major achievement, providing tools to overcome stigma, providing tools to overcome unawareness, educational modules, psychoeducational modules, preparing literature for patients, their relatives, preparing literature for support groups, having a whole lot of knowledge translation piece to decide how information can be imparted, not only about mental illness, but about mental health for children, for school children, for women, for workplace, and all those high-risk groups. There are clinical benefits, very clear clinical benefits. For example, there is going to be more identification of cases, no doubt about it. People are motivated, they go on internet, and as connectivity increases, as number of people using internet, number of people using digital mental health increases, all people have to do is to invite the population to the landing page of their websites. That remains a challenge. So that challenge again is in the field of marketing, social media development, digital advertising, etc., etc. And it's impossible to dissect the thing. It will not be possible to say that I'm not going to market a product because of ethical boundaries, or I'm not going to tell people how to diagnose depression, how to screen depression, because more and more people might do that. We might create fear for suicide if we talk about suicide. These things are not acceptable. What we will have to practice is a very solid evidence-based psychiatry, evidence-based mental health rules, regulations, and that is where it is important to catch. It's a tool with two sides. There is a sharp razor on the other side, and the sharp razor is very important to realize. It begins that most often the age of first encounter with a digital tool in children is coming down. Earlier it was 10 years, then it is 6 years, now it is 5 years, and maybe much lesser. I mean, first time a young boy, a newborn baby wants to touch a mobile and experiment, or wants an iPad, you can imagine what is the age. It's coming down. Now, when children are born, their brain is matured by 85%. Active metabolism is going on. Lot of social information, environmental inputs are bombarding already, which is important for the maturation, growth, cognitive development, intellectual development, social development of human mind. This time, in this phase, when we were careful about impact of trauma, abuse, anxiety, depression in mother, malnourishment, food, temperature, and cosmic effects, etc., there is one more adulteration, and that is the digits, the numbers, the screen, and it generates inquisitiveness. The inquisitiveness is the first cognitive stimulant which a child gets. Children are hooked on to mobile phone and iPad not because it looks pretty, but because it's stimulant for problem-solving behavior. It's creative. It's like giving, when we say you want to increase your resilience, you must face challenges. So we say today your task is X, tomorrow your task will be X square. Similarly, when a child starts playing with gadgets, he or she experiences problem solving. his inquisitiveness, inquisitiveness which arises, is the food for his brain. And that, I mean, if you see the hippocampus of these children, which it is enhancing much rapidly than rest of the brain. So there are studies which have measured differential areas of the brain, and the conclusion is that children with inquisitiveness, with more problem-solving stimulation, grow their hippocampus volume much faster. So it's exactly same thing happens with children. So when the brain was learning to adapt through neuroplasticity to different challenges in the environment, it's now adapting to a technological challenge as well. It's a good part, but there are reports about internet addiction, increase in psychiatric morbidity, increase in suicide, behavioral problem and drug addiction in adolescents, and so on and so forth. These challenges cannot be overlooked. We will have to develop a mechanism where we can save children from adverse effect of social media, adverse effect of digital technology. Otherwise, it's now. Don't get me wrong. Many people do ask this question. It does not mean that the children will lose their brain power. No. In fact, these children are much faster in multitasking. There are a number of studies which have proved that multitasking is because of early exposure to information processing stimulant. Therefore, they can deal with the numbers and they can deal with the music at the same time. Something which previous generation did not learn that effectively. So on one side, there are advantages and good news. The other side is a bleeding razor. We have to be cautious that more and more digital mental health is going to be in use, or more and more digital technology is going to be used. There is likely to be a rapid increase in psychiatric morbidity, a rapid increase in the risk for psychiatric morbidity. When we design program, it is important to have some buffers, some kind of preventive measures, mechanisms in place so that one can have checks and balances to avoid or at least intervene much early. Research is a growing area of interest, and without research it was not possible. It's an ongoing, the thousands of people are involved. Digital mental health gives rise to a number of challenging questions to researchers. For example, you may develop a test for doing IQ test or intelligence test. But now our challenge is that you have thousands of students in school, and if I want to do an intelligence, I need to have tests, I need to have a credible, reliable, effective, feasible test which can be administered in a group. So on one side, digital technology is solving problems of mental health issues. On the other side, the mental health is posing serious challenge to the scientific content for research to bring newer tools and newer technologies. Now, in this capsule, I would like to elaborate what we can do and what are my thoughts to promote digital mental health for students. So in Manasik Shakti, the initiative for students' distress or dealing with students' problem, what we have thought that we will combine the resources, the intellectual and academic component and service component in a manner so that without much investment, without involving too much of complexity, we can provide certain solutions. So what are the problem statements that we face? There are two main problem statements. One, about 75% of students express that they feel extreme stress in college life or student life. And the second problem statement is that many people do not succeed in their life. Everybody wants to succeed, but you know what stands between you and your success is your mental health. And therefore, we thought of combining these two capsules and coming up with a mobile app, a desktop-based app, and a software program in which we can provide solution for students as well as seek collaborations from institutions. So when you go on the website mansikshakti.in, you will see two boxes, one for students, another for institutions. If you click on institutions, that means if you are associated with an institution and want to establish collaboration for education, starting courses, training programs, courses for students, providing mental health information or mental health education, or establish strategic research, a research collaboration, or want to enhance capacity for research in your institutions, we can help. We are developing a hypothesis bank because we believe that local research is extremely important. India is a diverse country. What works in psychotherapy in Kerala, what works in West Bengal is not likely to work in Haryana. So therefore, depending upon the local culture, we have to come up with the capsules and modules so that effective intervention can be imparted to those students who feel distress and stress due to academic, social, relationship, or family-related matters. Therefore, we want to promote, establish collaborations, and add to the value whatever we can to enhance research capacity of institutions. If you click on students, you will see a number of facilities where you can see appropriate mental health information. You can have access to mental health education. What I mean by mental health education is that we need to tell our students what is body, mind-body regulation, how mind works, what are the psychological functions, how memory works, what is intelligence, and so on and so forth. What is good mental health, how mental health is involved in improving your capacity, your intelligence, your performance, and how do you develop better resilience, better mental strength. This piece of education has been developed in form of several courses. The courses are for mind sciences, for improving self-development, for learning special skills and trying to understand how to identify risk situations for mental disorder and how to promote positive mental health, whether it is through yoga or it is through meditation or due to any other cultural means. How to live a healthy life which is appropriate for achieving success, excelling in life, and becoming a robust citizen of this country. The other facilities are there that we have developed certain psychological assessment tools. So there are about half a dozen tools which has been put to research trial, and soon it will be on the website. One can find out three important questions. One, is there a mental health emergency at this point of time? Are you suffering from a serious depression? Are you hallucinating or having difficulty in sleep? If so, then you have access to mental health consultation via Telemanas or via district mental health program or via network of psychiatrists or going to the local general practitioners. The next question which every parent and every student must examine, is there a likelihood of developing a mental disorder in future in my sons, daughters whom I'm sending for university courses? So we are able to determine to some degree what is the risk. And the third question is, what is the strength of your mental state? So what is your resilience and what is your coping ability? Further, we are looking into the question of examining possibility of becoming successful. I am fully aware about stigma and ignorance, and it is not really a good idea that we ask a student, hey, do you have a mental disorder? Nobody is going to answer or land on the page. And therefore, we have rebuilt the design, and we are asking that please examine what are your chances of becoming successful. And in that question, we have rebuilt the question to examine the level of stress, level of psychiatric morbidity, possibility of risk, etc. Besides examining your potential, predictors, and characteristics of becoming successful. So after you do these assessments, you get a report. The report, which is generated based upon algorithms of machine learning, tell us three different options. One, that you have a significant psychiatric problem and therefore you must go and see a doctor. Second, you do not have a psychiatric disorder, but you are likely to have this and you must take certain precautions. These are the list of precautions, these are the courses you must undergo, and here is the facility for counseling. You must engage with a psychological counselor or a social counselor, or seek for mentorship, or seek for more support for your academia. The third option would be that you are perfectly okay, but you need to understand what is positive mental health. And we have provided certain courses, certain skill building measures, and various other resources to provide and add value to your daily life skills. We very much aspire to develop a tracking system where a student can come on a website, engage on a page, put their plan that this is what I want to do in next 6 months, 3 months, or 1 year. This is my profile, these are my challenges, these are my strengths. Do the test and your database is ready. And on a regular basis, you engage with the system. You get a dedicated counselor who guides you, supervises you, and carries you through. If you have difficulty, you can talk to him or her or chat. We want to develop a network of expert mentors who can engage with the students. We want to develop a network of expert psychologists and social workers who can help in emotional issues. We do not want a dedicated, eligible candidate just to miss their life by margins due to anxiety, stress, hopelessness, lack of faith, lack of confidence, etc. All these are correctable situations and we must try to deal with it. And this is what we are trying to do. We are trying to develop this digital platform. Hopefully, it will be in front of you next 3 months' time. So, my dear friends, we saw how digital technology is revolutionizing life of every individual, not just potential patients and their relatives. There is a future, there is a vast future, and these are irreversible changes. Just we need to forget living without digital aids, digital components in our life, and we need to start rethinking, innovating in much better way. How can we best use the technology without getting affected with its disadvantages, with its side effects, and how to save ourselves from internet addiction, mobile addiction, psychiatric disorders, and learn better time management. Management and organizational skills are the key component of today's requirement for all students. Thank you very much for giving me this opportunity and wish you good luck.